Over the past couple of years, we have become accustomed to terms like boosted and quarantine. But how well do you really understand those terms? In today's 2 Year Wellbeing, we're examining how knowing the terminology could impact your chances of getting or spreading the virus. Joining us today is Dr. Deborah Grant, the Chief Nursing Officer for Ambulatory and Population Health for Cone Health. Thanks so much for joining us today. The first question, isolation versus quarantine, is there a difference?
To the general public, Chad, that's probably not terms they're used to using. So it really just means stay away from other people. So there's a little bit of difference. Isolation means you have the disease. So you have this virus in this case. You know you have it. So then we say you must isolate. So that's staying away from people. If you've been exposed to it, then we say that's quarantine. So you know that you were with me for lunch today and we were giggling and laughing, and therefore we probably may have spread some germs there. And then I call you and say, oh, I must tell you, I just found out I'm COVID positive. Then you're under quarantine, I'm under isolation. So that's really the difference.
Got it. Okay. And when and how long should you isolate or quarantine?
Yeah, so in either case, you need to, especially if you're the one with it, isolating, you must isolate for 5 days. So at least 5 days after you started having symptoms. So you might have got tested on day 3, but your symptoms were 2 days ago. So you have to isolate for at least 5 days. And then after isolation, we really suggest people who have the disease to wear their mask for 5 more days and try to limit anywhere you're going if you can. If you're a quarantine, then that means for 5 days you're going to wear your mask as well, especially if you depending on your vaccine status, but you're going to do the same thing. Stay away from people for 5 days. You can get tested then, and if you're negative, then go on wearing your mask like we all should be doing when we're out in public with others, but after 5 days for quarantining if you're coming back negative with your testing.
Another term that we've been hearing a lot lately, fully vaccinated. When is someone considered fully vaccinated?
So it depends on where you're at in your progression of getting your vaccines. So most people are fully vaccinated when they have gotten their 2 shots and a booster, if it's time for a booster yet. So that really does depend. Our 5 to 11-year-olds, they started getting their vaccines later. So they may not even be at a time for a booster, because boosters are currently 5 months after you're vaccinated, for your first 2 vaccines, unless you got J&J. And then at 2 months, you can come back and get another vaccine for that. So fully vaccinated just means you have completed getting the appropriate number of COVID vaccines for your age group and for your type.
And so does that include boosters as well?
For most people, that is how they are interpreting it these days. But 2 vaccines, and you're not, let's say you're at 3 months, well, it's not time for it then yet. So you're fully vaccinated at 3 months when you've had 2 vaccines. But at 7 and 8 months, after you've had 2 shots, if that was what your series was, then you're not as able to prevent your body from getting that and getting sick with it. So it's better to go ahead and get your booster then at 5 months. So it depends on how you define the timing as to whether you say you're fully vaccinated or not.
Is it realistic to assume that soon fully vaccinated will mean that you have to include the boosters as well?
I think everybody's not sure about what that's going to mean as far as you're saying if your work is going to require it or different places. Most people are just wanting us all to get our 2 vaccines to get vaccinated, and that's where we're at right now, and counting that as being vaccinated. And now we've got our children 5 to 11, and we know that we'll have in the future, those younger than 5 years old too. So if we could just get everybody to get their vaccines, and then, we could catch up with the boosters.
Early on in the booster era, if you will, people were confused between the term booster and the term 3rd shot. Are they the same thing?
Yeah, I think early on, the 3rd shot we were using particularly for immunocompromised individuals. So if your body isn't able to produce enough antibodies, that's what it means when you're immunocompromised with certain kinds of diseases. So individuals who have cancer, some different kinds of diseases, maybe immunocompromised. So they needed to get a third shot, and they were the first ones to get a third shot. So that's a little different than what we call boosters now. So for the most part, all of us, if you're beyond 5 months after your first 2 shots with either Pfizer or Moderna, or 2 months after J&J, you should really get your booster to help protect yourself against this disease.
Another term that you probably knew well, but now we all know it, is breakthrough cases. Some people hear this term and they might think the vaccine must not be working, but that's not really true.
Correct. Breakthrough cases, early in the pandemic, you're right, we didn't hear that a lot, but that just means someone who did get their vaccines, whether they're the first vaccine or the second vaccine, or they're 5 months out and they've got their booster, they catch COVID and they test positive. That's called a breakthrough case. So that's where we came up with the breakthrough case, meaning you've already been vaccinated and now you're getting COVID as well. So what we have seen and continue to see is people who get vaccinated are not nearly as sick. Our hospitals are still filled mostly with unvaccinated people. So a breakthrough case and you've already gotten your vaccine, that means your body's got some medicine in it to help build up antibodies to fight that disease off. So you're not going to have as many symptoms and you're not going to get as sick if you had not been vaccinated.
There are multiple types of COVID-19 tests. Can you explain the difference between them?
Yeah, I would say that the simpler answer is there's the fast test that you can do at home now, and that's the antigen test. And we didn't have that test early on, so that was the problem. We had the PCR test, which takes longer. You go get it done somewhere, and then it takes 2 to 3 days, and nowadays it may take 5 days to get that result back. And that test is really looking at your overall disease. It'll pick up on COVID even sometimes up to 90 days after you've had it. So that PCR test is much more sensitive. It's picking up any time during your disease of having COVID. Whereas the antigen test, the one that's 15 minutes or not even 15 minutes, you get it at home and do it. That test is picking up to see if you have enough virus on you to be contagious. And that's why we were so waiting for these tests to come out, because that means if you take that test and you're positive, you are contagious right now. Whereas if you were waiting to take that test, it might not show up, later. So it's real important for us to, if you have the at-home test, or if you go to the government site now, order some of those so you can have that at home, especially when you think you've been exposed to someone, and don't do it too early. That's some of the guidance we give now is, if you just got contact yesterday and somebody called you and you said, I'm positive, you may want to wait a day or two if you have no symptoms, because it really has to wait till your body has some virus in it to be producing enough to make you infectious.
All right, Dr. Grant, 1 segment down, 2 more to go. We know that you have questions.
Okay.
She's going to be staying with us until 6 p.m., so text us your questions. The number is 336-379-5775. We're going to take a quick break, and we'll be right back.